most of these people who were diabetic already attributed the signs and symptoms to HIV. I've seen patients who come from far losing weight, and doctors, you are told by the patient, no, doctors have screened me for HIV for the 10th time now. And when the doctor finds the patient remains negative, it's very miserable. Instead of checking the sugar, the patient must be HIV. Okay? So most patients think whatever comes to them is either malaria or HIV. A diabetic comes, wakes up not feeling good, they are running to the toilet, they think it's malaria, they think it's HIV. The reason why people relate to this is because these diseases are well advocated for, well spoken about. Diabetes has not been spoken about. Diabetes has not been properly covered. Hypertension has not been properly covered. They are disease for neighbors, for the elite guys, for people who put on ties. Okay? It can happen to me. But malaria and HIV, like we said at the beginning, if we say Pius is HIV positive, now you all want to see what he looks like. But when we say Dr. Boskovic is hypertensive, we all keep quiet and say, it's a better disease, eh? Let him be. It's a better disease to have, not so? Yeah. So it's very important that as we are gathered here, we want to get this message clear that diabetes has got its own symptoms, and there is no organ that's spared, including the bones. And I've told you, including the teeth, the heart, the kidneys. Okay? I see in other countries there are policies now to say if a patient comes with diabetes to hospital or clinic, they should be screened for TB, and vice versa. If a patient comes with TB, they must be screened for diabetes. Okay? So it's very important to know that if patients come, you must look at all organs to say hypertension can affect any organ, diabetes can affect any organ. A combination of hypertension and diabetes makes things worse. How we look after ourselves when we get ill or before. Combination of individual measures, household remedies or herbs, religious acts such as prayers. All women here, we are all prayer warriors, eh? Prayer warriors. You should go to hospitals visiting time. Each cubicle, they will be talking in tongues, right? To chase away the evil spirit, which has caused dilated cardiomyopathy, or which has caused this stroke. Okay? Praying is very good, but we must also be focused and understand what we are doing. Because we know very well if a patient develops a stroke today, the first port of call is not the doctor. You will see, at times, healthcare professionals are consulted. But the most important people are those who give you holy water. Okay? Holy water is very important. And now we have prophets who are dishing out holy water. I'm sure if they would dish it into the whole city, we would drink very nice water. But and religious acts. Mapostor prophets on their own. Nangao, Aditi. So it's very important for us to understand who we are. If a patient develops chest pain today, would that patient go to the doctor first? Very few. This study proved that most people, they were at Parenyato. But before coming to Parenyato, they go to the prophet, to the priest, to the Nanga, and they will have gotten herbs, salt rubbed everywhere, small stones, all those things. These are beliefs. These are all religious beliefs. Okay? Okay, and you know very well that nowadays religious water is being sold everywhere. Okay? So it's important for us to say, when we are dealing with our hypertensive patients, our diabetics, what type of thinking are we dealing with? These are people who are saying, if I don't pray properly, my disease will not go away.